viewers, my name is Precious Magocho, a level 21 student at Midland State University, and behind the camera is Blessing A. Office. And today I am in Zvishavane town and city medical and dental center. I am going to interview Mr. Tyrone, who is the clinical nurse. So, say, how are you?
I'm alright, how are you?
I'm fine. Can you please introduce yourself to the viewers?
Alright, my name is Tyrone Tinashe Ndengep. I'm a registered general nurse here in Zvishavane District Hospital, and also here at City Medical and Dental Surgery. Yeah, so I'm age 28 and married, no kids yet. Yeah, that's me.
Mr. Tyrone, can you please tell me where you were born?
Okay, so I was born in Manicaland province at Tare district, Tare Provincial Hospital actually. Yes.
Where did you grow up?
So the major part of my childhood I was in Chipinge, where I did my primary and secondary education. Before I went to Harare for my tertiary, then to Mashingo for another tertiary, then yeah, I am in Shawani.
Okay. What inspired you to be a nurse?
Well, it was by, let me just say, coincidence actually, because it was during the COVID era where schools were suspended for a bit, but nursing being one of the essential services, they were still ongoing with their lessons, and somebody just said, let's go and try out nursing. So it was actually tried out. But then when I went there, I started enjoying it, and now here I am. It's what I'm pursuing.
Okay.
Yeah.
So was it your dream job to be a nurse?
I wouldn't say so, but if you ask me to change now, I don't want to change.
You don't want to change. You're
I
not
don't want to
enjoying it.
change. I don't want to change. Yeah.
You're not enjoying it.
Yeah.
On your way on becoming a nurse, did you by any chance face challenges? And
Okay.
how did you overcome the challenges?
So the nurse training journey is a challenge on its own, because people, they think that nursing is a simple because of the requirements for the course, but I tell you this, since day one to the finishing day, yeah, there are hurdles after hurdles. It's actually a challenging course, and yeah, we had to be on our toes throughout, between the clinical area and class area, exams and everything. It was quite a hassle, but yeah, we managed.
So can you please tell me what's the most rewarding part of this job as a clinical nurse?
As a clinical nurse, we have the chance actually to meet a lot of people in different kinds of situations, and some they have a heavy burden on them due to the ailments or illnesses that we facing. And what's most rewarding is you help somebody, they go, they get better, and one day you just meet them anyway in town or on the road, and they'll be like, "Doc, thank you very much. You helped me so much, and now I'm alright." You know, it feels like something to somebody and it changed their life. That's the most rewarding part. Actually, seeing an ill patient who was bedridden walking out of the hospital, feeling fine, that's rewarding to us.
Okay.
Yes.
And what is the biggest challenge you face on a daily basis or weekly basis?
Yeah, those challenges that we face, maybe, you know, the work areas that we work in, sometimes maybe you'll be understaffed, under-resourced. Sometimes you know what you want to do for the patient to get better, but you don't have the resources to do it. So you end up, we have to improvise and improvise. If somebody has to get better in 2 to 3 days, it will actually maybe take a week or so. So those are the challenges that sometimes you face, and also sometimes you face maybe cultural differences. Some people, they don't in their cultures, they don't believe in these medical practices that we do. So somebody might be sick and they will come to the hospital just because maybe the sickness is advanced to a certain point that they cannot stay with them at home. But some of the medical or surgical interventions that we want to do to the patient, they will refuse because they think, no, we don't believe in this. Just do something that they get better, but they will be hindering you to carry out what you really want to do. So those are the challenges that we meet, and yeah, maybe even sometimes our clients or patients, when it comes to their financial constraints, maybe some of the services that you want to render to them, they will be outsourced. So you want maybe the patient to get some lab tests done so that you can have a clear picture on what's happening on the inside, blood work or x-rays, and they'll need money. And when the patients don't have the money, you cannot actually diagnose the real cause of their ailment. So it will be difficult treating them blindly, but so those are some of the challenges that we meet.
Okay.
Yes.
Ms. Tyron, can you please tell me how do you handle the emotional stress of this job?
Well, yeah, it comes with a lot of emotional stresses because of the things that you see, things that you encounter. But the way I actually maybe personally handle that is sometimes you have to make personal time for you and family and everything. That is totally discharged from the job, because you need to refresh your mind. You need to start over before another day. So if you after a long day at work, you go home, refresh, you have your personal time, so that tomorrow you are recharged. If you carry that burden home, you don't rest. You get what I'm trying to say.
Yeah.
And you have to prioritize your mental health. You have to prioritize your personal time from the job. And when you're on the job, you give it 100%, but from the job, give it 100%.
Okay.
Also, your personal time, you give it 100%. 100% on the job, 100% on the personal time. That way, you reboot, you recharge your system, so that tomorrow you go back and give it 100% again.
Okay.
Yes.
So, was there a time in this your journey as a nurse when you encountered an emotional scenario?
Pain, or sometimes patients they might feel like this is the end, and they'll call you actually. They'll say, please just stay beside me. I just need you to stay beside me. Maybe so at one point, this old man, he was around in his 80s, maybe. He just said, "Come sit beside me, hold my hand." And a few minutes later, he just went just like that. So that it drains you, not like it drains you, like the emotions that overwhelm you. They're just a lot. They're just a lot. Yeah.
So, in your previous lesson that I asked you, I heard you said something about going out of way for patients.
Yeah.
Like you encounter a situation where patients come and they may not have money to pay for the bills. And have you encountered such a scenario whereby you take money from your own pocket and pay for the patient?
Yeah, yeah. There were sometimes that not me alone, but me and my colleagues. You would find a patient that they come, maybe they are diagnosed a condition and they need medication. They don't have that money, or they need also additional tests to be done, and they don't have money. But that those blood tests are the ones that we can actually use to correctly diagnose the patient, so that we can treat them right. And if this is not done, there's nothing that you're doing for this patient. And you look at that background and you see there's no way they'll get this money. So should we just leave them in? No. So sometimes we try by all means, where we can. Where we can't, it's not like we don't want to. So there were some points when I remember there were some times where we could actually forward from our pockets to get their medications, or maybe to get tests done or x-rays done. Yeah, it was like that. And at some points, it's one scenario we had a dumb baby when we were still at school. No parents, no relatives. It's just a dumb baby. So we made sure the baby is fed, the baby is bathed, the baby is clothed. So sometimes there are things that you may find at the hospital, but they need change of clothes always. So we could end up buying those clothes for them. The hospital meals, they are just like straightforward. So we could go home, we prepare something to bring the kid.
Oh.
Yeah,
So what advice would you give for someone out there who wants to be a nurse just like you?
yeah, nursing, it's a very good profession, and it's amazing. Someone comes, they're sick, they go back happy because they've done this, but it takes passion. It also takes someone who gives it 100%. Don't come into this profession for maybe the benefits that you might find, maybe monetary or whatever, or prestige. No, it's not about that. You have to be 100% in it. Because sometimes it really needs your emotions. It really needs your dedication, not just your qualifications. Yes.
So, Mr. Tyrone, thank you so much for your time, and we really appreciate the continue saving lives.
Okay, you're welcome. You're welcome.
Thank you so much. So don't forget to share, like, and comment.